Irritant contact dermatitis happens when the outer protective layer of the skin becomes damaged by repeated exposure to irritating substances. Soap, cleaning products, hot water, solvents, perfumes, and even constant friction can slowly weaken the skin barrier until redness, itching, burning, cracking, or peeling appear. Unlike an allergy, this reaction does not require the immune system to recognize a substance first. The irritation comes from direct damage to the skin itself. The skin barrier is made from tightly packed skin cells held together by natural fats called lipids. These lipids act like mortar between bricks and help keep moisture inside while blocking irritants from entering. When harsh chemicals strip away these oils, the skin loses water much faster and becomes inflamed. This is why people with irritated skin often describe a tight, dry, painful feeling before the rash becomes severe. One of the most effective ways to improve irritant contact dermatitis is removing the original trigger. Many people continue using the same soaps, detergents, scented products, or disinfectants that cause the irritation in the first place. If the skin is constantly exposed to the damaging substance, healing becomes very difficult. Identifying and avoiding the irritant allows the skin barrier to rebuild itself naturally. Frequent hand washing with strong soap is one of the most common causes of this condition. Hot water removes natural protective oils much faster than lukewarm water. Washing for long periods also increases damage because water itself can weaken the skin barrier when exposure is repeated many times per day. Dermatologists sometimes call this wet work dermatitis because constant moisture exposure can be surprisingly irritating. Natural oils can help reduce water loss from damaged skin when used carefully. Plain sunflower oil and virgin coconut oil have both been studied for their ability to support the skin barrier. Coconut oil contains fatty acids such as lauric acid, which may also reduce the growth of certain bacteria on damaged skin. Thick, fragrance-free moisturizers are usually more protective than thin lotions, because they create a better seal over cracked skin. Oatmeal is another simple, natural option that has been used for centuries to calm irritated skin. Colloidal oatmeal contains compounds called avenanthramides that may help reduce itching and redness. Adding finely ground oatmeal to a lukewarm bath can soothe inflamed areas without exposing the skin to perfumes or alcohol-based ingredients. Many medical skincare products still use oatmeal because of its gentle anti-inflammatory properties. A damaged skin barrier also becomes more vulnerable to infection. Cracked skin gives bacteria and fungi easier access to deeper layers of tissue. This is one reason severe dermatitis sometimes becomes painful, swollen, or develops yellow crusts. Keeping the skin moisturized and avoiding scratching helps reduce the risk of secondary infections. Diet can influence skin health because the skin constantly needs nutrients to repair itself. Vitamin C helps the body produce collagen, which supports skin structure and wound healing. Foods such as oranges, kiwi, strawberries, bell peppers, and broccoli naturally contain high amounts of vitamin C. Zinc is another important mineral for skin repair and can be found in pumpkin seeds, beans, lentils, nuts, and whole grains. Omega-3 fats may also support healthier skin by helping regulate inflammatory processes in the body. Fatty fish such as salmon, sardines, and mackerel are rich sources of these fats. Plant sources include flax seeds, chia seeds, and walnuts. While food alone does not magically cure dermatitis, a nutrient-rich diet gives the body the raw materials needed for repair. Hydration matters because dry skin becomes easier to crack and irritate. The outer skin layer naturally holds water using molecules called natural moisturizing factors. When the skin dries out too much, tiny invisible cracks can form and make irritation worse. Drinking enough water and protecting the skin from overly dry air can help support recovery. Stress can also make skin inflammation feel worse. During stress, the body releases hormones such as cortisol and adrenaline that may affect inflammation and skin sensitivity. Many people notice flare-ups during periods of emotional strain or lack of sleep. Gentle exercise, regular sleep, meditation, and relaxation techniques may indirectly improve skin comfort by lowering stress levels. Some people believe every skin rash should immediately be treated with strong medicated creams, but treatment depends on the severity and cause. Mild irritant dermatitis often improves significantly when the trigger is removed and the skin barrier is protected. However, severe inflammation may sometimes require medical treatment to prevent worsening damage or infection. Natural supportive care works best when combined with accurate diagnosis and sensible skin protection. Protective gloves can help, but the type of glove matters. Latex, rubber additives, or trapped sweat inside gloves may sometimes create additional irritation. Cotton gloves under protective gloves can reduce moisture buildup and friction during cleaning work. People who work with chemicals, food preparation, or hair products are especially at risk because of repeated daily exposure. Fragrance is one of the most overlooked skin irritants. Many products marketed as fresh, clean, or natural still contain aromatic compounds that irritate sensitive skin. Essential oils may smell pleasant, but can trigger burning or redness in damaged skin because they contain concentrated plant chemicals. Fragrance-free skincare is often safer for irritated skin than heavily scented products. The skin also repairs itself faster during sleep. At night, blood flow to the skin increases and repair processes become more active. This is why chronic sleep deprivation may worsen inflammatory skin conditions over time. Consistent sleep schedules can support the body's natural healing systems. Another important fact is that overcleaning is not always healthier. Many antibacterial soaps and harsh disinfectants remove beneficial oils and microorganisms that normally help protect the skin. Healthy skin naturally hosts a community of bacteria called the skin microbiome. Disrupting this balance too aggressively may contribute to irritation and dryness. Cold weather often worsens irritant contact dermatitis because low humidity pulls moisture from the skin more quickly. Indoor heating systems can make the air even drier. Using a humidifier and applying moisturizer immediately after bathing can help trap water inside the skin. Dermatologists sometimes call this the soak and seal method. People sometimes confuse irritant contact dermatitis with allergic contact dermatitis, but they are different conditions. Allergic dermatitis involves an immune reaction to substances such as nickel, fragrances, or certain preservatives. Irritant dermatitis is caused mainly by physical or chemical damage to the skin barrier. A dermatologist may use patch testing to determine whether an allergy is involved. Certain warning signs mean professional medical evaluation is important. Severe swelling, spreading redness, pus, fever, intense pain, or dermatitis that does not improve may indicate infection or another skin disease. Conditions such as eczema, psoriasis, fungal infections, or allergic reactions can sometimes look similar. Accurate diagnosis matters because different conditions require different treatment approaches. The healthiest long-term strategy is usually prevention combined with barrier repair. Gentle cleansing, avoiding known irritants, protecting the skin from excessive moisture loss, eating a nutrient-rich diet, reducing stress, and getting adequate sleep all support natural healing mechanisms. Instead of trying to force the skin to recover overnight, these habits help restore the protective barrier the body was designed to maintain. Healthy skin is not only about treating visible symptoms, but also about protecting the biological systems that keep the skin strong in the first place.